one last question, and you probably already answered it a couple times, but I guess what do you think the future of telemedicine, or in your case, in home care, provider care, what do you think the future of that is, and what do you see that most people don't?
Well, we did a press conference last week. John Halamko is the president of the Mayo platform, and I did a press conference. It was sponsored by Google, and a lot of media was there, and someone asked me that question, and the question had embedded in it a supposition around technology, and I challenged it. So I think the future is uncertain, Kyle, but through my lens, I'm going to tell you what I'm going to do with every breath left in my body to make the future I'm about to tell you happen, instead of the future that everyone else is talking about in healthcare, particularly healthcare tech investing. When you're sick, I have cancer, so I've been through a lot. Both of my parents were Holocaust survivors, and illness, and my brother died of Tay-Sachs disease. So sickness, illness, death, my ecosystem. I grew up with it. I live with it. Medical care is 50% science and 50% spiritual healing. When you're sick, you're afraid of dying. There is no medicine for dying. There is no recovery from dying. Dying is the most existentially pure and simple question that's been going on since we were conscious human beings. We're afraid to die. We just are. And when we get sick, we're one step closer to understanding that we might die. So when we're ill, particularly seriously ill, particularly hospitalized, in the back of our minds, are we coming closer to that point in time where we as a Western culture, we don't want to talk about death. Other cultures are a little bit more intimate with it, but we're not. We're afraid of it. So here comes the hospice nurse. Oh my God, I don't want hospice. That means I'm going to die. But you are going to die, and hospice is going to help you. No, I don't want to talk to hospice because I don't want to die. So in the end, 50% of healthcare is spiritual healing. It's actually talking to your soul about its fear of death, about comforting you, about caring about you, about making you less afraid. And the only way you could make me less afraid, if I'm afraid, is if you look at me and you honestly say, how are you today? You hold my hand and you look into my eyes, and I realize you were born to heal. You've been called to care for me. No freaking AI app. No artist does that. There is that. No app calling you and saying, how are you today, Mr. Schwartz? Did you take your beta blockers today? That's not a sentient being calling you. That's not healing. That's a mechanical process trying to replace a human process. So 50% of medicine is healing. Healing is done by healers. Healers are called to care for people that are vulnerable and afraid and sick. That's what healers do. So the future that I see is technology is in service of healers, not replacing them. The direction we're going is replacing them. We're creating more and more apps, more and more menus, more and more tech to replace the thing that causes people to safely navigate illness, which is human comfort, which is why when the doctor came to your house at the end of the day, wearing the stethoscope, holding your hand, that was medicine. Even though the doctor didn't have CAT scans yet, didn't have really sophisticated, customized medication for cancer, yes, you died much younger, but you actually felt cared for. And we're all going to die. We're all going to die. The question is, how do we choose to die, and how do we choose to live? So I think the future of medicine, if I have anything to say about it, is to take real healers, and I'm blessed. Every one of the 100 people in my company is a healer. Every one of them is a healer. Arm them with technology that allows them to be more effective with patients, as opposed to replacing them. That's the future that I see. So there is no investment thesis around how that looks yet. When I talked about tethering, having a paramedic come to your house, one of them are firemen. People love firemen. Fireman comes through the door, patient sees them, they're already feeling better, right? And then there's on the screen, there's the doctor who they love. They love our docs, so they're talking to the doctor, the paramedic's there. That's healing at work using technology. That's healing. So to me, the future is healers using technology, not healers being replaced by technology. Now, I'm probably wrong in terms of where you're going to bet your investment money, Kyle. I'm one tiny little voice, well, medically home is having a gigantic impact. And I'm hoping, and the reason I do things like this, I'm hoping to spread the word that there is an obvious gap in the way we're thinking about medical care going forward. And one last thing, if I took 100 doctors, put them in a room, male, female, young, old, and I have every one of their mothers is ill, and I have the actual case notes on their mothers and the back of the picture of the doctor in their CV. Here's the doctor, their CV, here's their mom and their notes. And I say to them, you have a choice. You could put your mom in the hospital, whatever hospital you're affiliated, or we could take your mom home and do what Medically Home does. You know, not one doctor would send a patient to the hospital, not one, because it's their mother, because they love their mother. They love their mother. And they're not going to put their mother in the hospital if we could do all this for them at home. And I've done that, Kyle, over and over and over again. I've done that for the last 12 years. If we could do all that, I want her home. Of course I want her home. It's the same doctor that's saying I'm afraid to take care of the patient in the home because, so it's healing and what we need to do to care for patients is obvious. It's in the heart, but we're losing sight of that, and we're creating processes, workflows, handoffs, transitions, industrial. And I know a lot about industrialized processes because that's what I did for a big chunk of my career. I built and redesigned factories. That's what I did. Human beings are not on an assembly line that you're putting a UPC code on and throwing it into a carton. They're souls. They're souls. They're close to God. And we're not supposed to be doing that to them. So that's my soapbox. Thank you for listening to that.